Hi, everyone. Thank you so much for joining us this evening. My name is Dr. Beslim, and I'm a psychologist. And we're here on behalf of Silm Center for Mental Health to provide you with some information on ADHD strategies, specifically for post-secondary students. And so to share her wonderful knowledge with us is Suweetha. Suweetha is just about to finish her master's at Adler Graduate Professional School. She is a registered psychotherapist in her qualifying status. Suweetha is super knowledgeable. She's been working with young people for many, many years, and I'm really excited to hear what she has to share with us today. So Suweetha, I will let you take it over.
Thank you so much, Beslim. So I'm just going to take a moment to share my screen and also just to say thank you for everyone who's going to be joining us today. Hopefully you'll find this presentation useful. If not, I'm super sorry, but hopefully you'll find it entertaining and useful. And it'll be short and sweet. And I want to focus a little bit more on strategies. I tend to find that when it comes to ADHD, there's a lot of people who've tried many different things and you kind of hit a roadblock. And I'm hoping that with this presentation, I'll help to kind of ignite some new ideas on how to deal with a lot of roadblocks. So first, what I'm going to talk about is what ADHD is. So I'm assuming that for a lot of people joining today, you'll have a basic understanding of ADHD. So I'm not going to go into too much detail, but enough to be able to follow along with the presentation. Next, I'm going to talk a little bit about the importance of post-secondary education and why this time in a young adult's life is so important when you're struggling with ADHD. And lastly, I'm going to talk a little bit about strategies. So first, what is ADHD? So the DSM text revision, so the newest one that came out in 2022, defines ADHD as a continuing pattern of inattention or impulsivity or hyperactivity that impairs an individual's functioning. So sometimes with ADHD, we'll see that someone will struggle with sustaining their attention, with listening, with starting and finishing tasks, organization, and forgetfulness. You'll also see a pattern of restlessness or like feeling like they're always on the move, or challenges with impulsivity, especially in the areas of spending or addictions, or even in terms of like interrupting others when they're speaking or having trouble waiting your turn. So in Canada, the prevalence of ADHD in children is about 7 to 11%, and then it's about 3 to 5% in adults. Now, it is typically diagnosed in childhood. However, many individuals find that they can cope with their symptoms as kids. And then as they go through different transitions in their life, they find that they kind of hit a wall and all the strategies that they used growing up no longer work for them. So usually we see clients kind of hitting a wall when they reach adolescence, when they enter post-secondary, and when they become a parent. So it's believed that ADHD is caused by or is linked to neurological and genetic factors. So brain imaging studies show that individuals with ADHD experience delayed development in several areas of the brain that we know are linked to, I'm not sure if you can hear my neighbor drilling, but if you can, I'm really sorry. I'll try and speak louder. But we know that ADHD is associated with severe development in certain areas of the brain that are associated with executive functioning and emotion regulation. So that's like the amygdala, the hippocampus, the caudate nucleus, and the nucleus accumbens. So these areas are involved in things like decision-making, our mood, our working memory, our ability to prioritize certain actions, and our ability to engage in purposeful behavior. We also see that in ADHD, there's lower levels of norepinephrine, dopamine, and serotonin. And these are basically our chemical messengers in our brain that transmit messages to allow us to be alert, to be aroused, and can be related to impulsivity in our mood. So why did I choose to focus on post-secondary? the thing is that worldwide, the prevalence of college students with ADHD is about 16%. So there are more students with ADHD now attending post-secondary than ever before. But what we're seeing is that we continue to have less college readiness among these students, lower GPAs, higher rates of school disengagement and dropping out, and just a greater level of social impairment and difficulties with anxiety and depression. And students with ADHD tend to have a harder time when it comes to managing full-time and part-time employment. And so what ends up happening is they'll end up taking extra years of education when they're in college and university, and then this leads to greater debt when they graduate. Now, why is post-secondary a transition that's so tricky? Well, at this time, you have big class sizes with a lack of one-on-one attention and engagement from your teacher. You're transitioning to a time of greater independence. You're responsible for things like your laundry, doing your own dishes, your commute, making your own meals. And this all happens on top of possibly working your first or second ever job and trying to navigate new social situations. So all these new things that are kind of happening at the same time create the perfect storm for someone who has ADHD. Now, on top of this storm, you have individuals who may be undiagnosed or untreated with ADHD, and they may be experiencing elevated symptoms or maybe these new symptoms that are really hard for them to make sense of, especially when you don't have teachers and parents who are there to guide you. And for adults who are just experiencing these symptoms for what feels like the first time, you may be questioning yourself, like thinking you're lazy or you're just forgetful or disorganized. And so adults who are suspecting that they have ADHD often are dismissed by the people around them and in their lives. People say to them, well, you know what, you've come this far, you can't possibly have ADHD. And that makes it really tough for someone who's suspecting this of themselves to be able to approach an assessment or approach treatment. So if you haven't been diagnosed with ADHD and you are interested in getting an assessment, this can be done by a general practitioner, a psychiatrist, or a psychologist. And most individuals who are diagnosed with ADHD in Canada are diagnosed by their general practitioner. But if you're looking to get accommodations through your school, usually the accessibility department on your campus will require proof of diagnosis, and for that to be completed with a complete diagnostic assessment report, which is typically provided by a psychologist. Now, ADHD assessments can be pretty expensive, so they're usually on average around $2,000, and they're not covered under OHIP. Now, psychiatrists can also diagnose ADHD, but with their assessments and what information they provide, it's usually not enough for a college or a university. Now, if you are interested in getting an assessment, it would be worth it to reach out to your campus and to see what kind of services they offer. If there's anything that they can offer that provides like a sliding scale or something that's more low cost for an assessment. There's also JVS Toronto, which provides low cost assessment options for those who are interested. Now, the reason why colleges and universities can't be so nitpicky about getting a full assessment is because diagnosing ADHD in adulthood is really tricky. There's a lot of different disorders that kind of overlap with ADHD and will look like it. And from the school's perspective, they just want to make sure that their student who's coming towards them is getting the right accommodations and that it makes sense for them. And they want to make sure that that diagnosis is confirmed. So now I'm going to jump into strategies since we know what kind of impacts individuals with ADHD and kind of what it is. Now, with that being said, I do have a caveat. The thing is that these strategies are not one size fits all. So some strategies are going to work for some individuals and it might not for others, and that's okay. Really just take what you can from the rest of the presentation. If you like it, take it. If you don't, leave it. And my hope is that it will spark another creative avenue to kind of address the roadblocks that you might be facing when it comes to ADHD. So first, I do want to say that ADHD is not totally what you think it is. So oftentimes I'll meet parents who are coming in and they'll bring their child for an assessment and they'll say, you know what, like my child's teacher keeps saying that they're not handing in their homework, they're not paying attention in class, they're usually talking to their friends. Their desk is pretty disorganized, so they're often forgetting things or they're losing things. But I know that they can't have ADHD because they can focus on Minecraft for like 3 hours. This is the thing about ADHD. So it's not about a lack of attention or an inability to attend. With ADHD, it's that your attention is directed to something that may not be considered the priority in that moment. And what's considered the priority is kind of subjective. It's subjective to you and to the people around you. So for example, if you were in a lecture hall and you were chatting with your friend about plans for dinner tonight, and your prof was giving explanations and instructions for a deadline for your paper at the end of the semester. In that case, the priority may be listening to your prof and getting down that information, because who knows if they're going to provide it again or if it's not going to be as detailed as, what's in the syllabus, whatever it might be. The priority in that moment would be to listen to your prof. But if you were chatting with your friend about dinner in like the first 10 minutes of lecture, which is usually nothing's happening, then chatting with your friend would be the priority rather than just kind of sitting there and waiting for class to start. So it's really subjective to what's happening in the moment, and it's going to vary depending on each person. Now, with that, we kind of want to think of ADHD and the strengths and the tools that you have, kind of like a video game. So in a video game, you're going to have certain weapons, you're going to have certain skins that you can attach to a certain character, and it'll make it more likely that you're going to succeed when you perform a certain task. And so with individuals with ADHD, you have 4 items in your inventory that you can manipulate and make it more likely that you're going to complete a task. And so what I'm going to go through now are those 4 items that you have in your inventory. So the first item that you have is novelty. So whenever you're working on a kind of task that's become routine or lackluster and you're losing motivation to really keep working on it, think of something new that you can add to the scenario to bring it back to life. So for example, if you're writing an essay, it's a 10-page paper and you're really just losing steam, you could write each paragraph in a different font, in a different color to reignite your interest in that paper. Another thing you could do is if you've gotten tired with your workspace, you can bring in new items or rearrange your workspace to liven it up and make it more interesting. So for example, on my desk, I have a little side duck and I have a rubber duck, because apparently I have a thing about ducks. But this is something that I keep on my desk all the time, and these are like little trinkets. But what I can do is every month I can switch these out. Maybe I want to put Bulbasaur on my desk, or maybe a blue duck, just to make the environment more engaging and more interesting for me. And another thing you could do is, like, if you were in lecture and you're having a hard time kind of paying attention, but you like writing with gel pens, then you can use a different gel pen every time that you write your notes in class, just to keep it interesting and keep you in the flow. Now, another task or item that you have in your inventory is interest. So when you're facing a task that could be boring or anxiety provoking, you can think of something that you genuinely enjoy to make that task a little bit more palatable. So for example, if you have a hard time with like your nighttime routine and maybe taking off your makeup and brushing your teeth before bed, maybe watching Netflix or like a crime documentary while you do that, to get you more interested in doing that activity. You could also like listen to a podcast while you fold your laundry. If you like being outside and you happen to live in an apartment with a balcony, maybe fold your laundry outside. You could also like listen to music that you really love while you're studying. Music could be a tricky one depending on like whether you find it distracting. Sometimes with ADHD, like lo-fi music, instrumental music could be really helpful. Putting on some pop music to kind of get you energized and in the mood can be helpful for studying as well. And also playing mind games. So for example, like let's say you have all your clothes on the floor and you really want to pick them up, but it's just been kind of something you've been delaying for a while. You can think to yourself, okay, the floor is lava and all my clothes are going to burn in 3 minutes. How fast can I pick all this up and throw it in the hamper? Or let's say your roommate is in the washroom and you know they typically spend about 5 minutes in there in the morning. You can say to yourself, okay, how quickly can I get this garbage out and on the curb or down the chute? And can I do that faster than they can be in the washroom? Or maybe you put the microwave on to warm up your lunch. What can I do in 2 minutes? So gamifying tasks can make it more interesting for yourself. Okay. Similarly, you can also use rewards. So that's going to be your third item in your inventory. And this will be really helpful to encourage you to do a task that you really don't want to do. So for example, you can tell yourself that you're going to walk your dog around the block after you've read 5 pages of your textbook, or you'll play 2 hours of Fall Guys after you study for your exam for 2 hours. Now, the key to creating rewards is that they have to be guilt-free and things that you can allow yourself and accept to be fully guilt-free. Now, often with ADHD, there's this feeling like I have not earned this time for myself. Like I haven't accomplished anything today. How dare I justify giving myself this time for me? The thing is that you'll end up taking this thing you love and using it as a punishment for yourself. And that's not really motivating. And if anything, it might not really help you continue to get the task done because now you're just kind of forcing yourself to keep going and working on it. So it's not really making this task inviting. And frankly, you've been fighting a battle with yourself all day to try and get something done. So it might be okay to just take a break from that and do something that feels rewarding. And the final item in our inventory is one that we're all very familiar with, which is urgency. So one reason why sometimes we tend to feel stuck on a task is because we don't have a deadline for it and we don't know when it's going to be over. So to assist with this, you can create progressive deadlines to get a task done. But other times it's kind of hard to convince yourself that that's the real deadline. So for example, you could be like, well, Suweetha, sure, I said I'll get this paper done by August 5th, but I know it's really done August 21st. So I'm going to wait until August 21st, and your brain's going to do that. So if progressive deadlines don't work for you, that's okay, but it is something to kind of give it a shot. Now, the trick with urgency is you got to find your sweet spot. So if you start a task too early, knowing that you have a lot of time to work on it. So for example, if you say like, I have all day to put away my laundry, then guess what? It's going to take you all day to put away your laundry. And that's because it follows Parkinson's law. Work expands to fill the time available for its completion. So the idea of planning ahead and starting early, it sounds really nice. But if you know you can do the same thing in like half an hour or less, then in the end, you're going to be saving yourself more time in a sense if you do it last minute, and you are going to make the task much simpler. On the other hand, if you do it last minute, you might find yourself feeling stressed, overwhelmed, and anxious because now you're rushing to complete a task and you don't have enough time, or you're not completing it at a level where it feels up to your standard. And so what you want to do is find just the right amount of stress and just what that sweet spot is for you. So if you already know that you tend to underestimate how long it takes you to complete a task, try to double that time, triple that time, and experiment with it until you find what that sweet spot is for you. So that way you develop just the right amount of urgency. Now, the next sort of recommendation I have is to take advantage of what your school has to offer. So really check out what your accessibility office will offer you. Some schools typically offer like a quiet space for you to work in to do your exams. You'll get some extra time to complete your assignments and exams. You'll have some note-taking assistance and some early registration. Now, you might be thinking, like, hey, I don't really need that stuff. Like, I don't need extra time on my exams. It's not going to help me. And that's fair. Now, the tricky thing is that it could be a nice thing to have in your back pocket. So maybe for your first 35 courses, you didn't need the extra time. But then that 36th course comes around, and guess what? It's stats, and you don't like stats, and it's really hard. And now you're like, man, I kind of wish I had that extra time. So it is kind of a nice thing to set up for yourself at the beginning, just so that if you ever need the support or you do hit that wall, it's there for you. And worst case scenario, you just never use it. You can also look at whether your school offers writing assistance, peer groups, and a coaching system. And another recommendation would be to check out your professor's office hours, your TA's office hours. One thing I would say is that checking out office hours can feel kind of intimidating. And so it might be scary to, talk to your prof, especially if you want like extra time on something or you need extra help. Now, the only reason why I would recommend this is because even in my own personal experience, you would have professors who would be really understanding. And with that, they may give you an extension, or they may adjust an assignment to kind of fit you better. So for example, when I was in my undergrad, I had a lot of social anxiety. So in classes where participation was required, I would lose the full 10, the full 20%. But I approached some of my profs and told them about my social anxiety. And some of them were willing to say, hey, Suweetha, you know what? Instead, what I'll do is I'll have you submit 5 questions at the end of class. So you don't have to raise your hand, but at least I'll know that you're paying attention and that you're grasping the concepts that we're talking about. And then I'll have other profs who are like, sorry, that's just the criteria that's in the syllabus. Like you're just going to end up losing that 10, 20%. So in those cases where I had profs who were willing to kind of meet me halfway, it was really beneficial. And so it might be helpful just to kind of talk it out and see what they can kind of help you out with. Recording lectures is also a great one, and this is something that you may get through your accessibility office. Now, this will allow you the opportunity to really focus on what's happening in class, and then you can review the recording and take notes after. So it gives you a little bit more flexibility in terms of consolidating what you learned. You can also look into counseling services at your school. So if they have any free ADHD coaching or any free therapy, it might be something you might be interested in. They could also hook you up with some resources in your community. Now, the reason why I think it's important to talk about what your school offers is because research shows that students with ADHD use school resources at a very low rate. So less than a quarter actually use accessibility services. Now, these services are there for you. So if you want to use them, think about what is getting in the way for you. What are those barriers? How can we address those barriers and chip at them? So that way you'll be more likely to use the services that are there for you, just in case. Now, with ADHD, you've probably heard many times before that having alarms, having calendars, having an agenda is going to be the best thing for you. So I'm not going to harp on it too much, but I will say that when it comes to scheduling, with post-secondary education, you do have more freedom in terms of how you want to plan your day. So really take advantage of it. One thing is to register early. Figure out what courses you want to take, figure out which profs have the kind of teaching style that really jives with you. So that way you'll be more likely to get into those classes. Highlight the first few weeks in your calendar, because those are the weeks when, if you're going to drop a course, you're more likely to get your money back. So experiment with the different classes, look at the different syllabi, figure out, is this assignment doable for me with my other courses? Are these assignments something that I'm actually interested in? Am I honestly going to be able to do it? So really be honest with yourself about the classes that you're taking. And worst case, you can always move that course to another semester if you have to. And also consider taking a reduced course load or smaller class sizes. So that way, usually smaller class sizes offer like more creative assignments. So it's not just purely lecture style. If you're a shy person like me, then those seminar classes are going to be really scary. So maybe don't do those, but kind of figure out what works for you. Now, when I talked about the reduced course load, that's something that can be kind of intimidating for a lot of people. The idea of taking only 3 courses or only 4 courses, because you might be looking at your peers saying, well, they're taking 5 courses per semester. it really comes down to what is most manageable for you. And graduating within 4 years or 2 years or whatever your degree or diploma requires is really just a suggestion. Use that time with however you like and what's going to work best for you. You also want to figure out how you want to manage your unstructured time. So when you're in post-secondary, you're going to have these big chunks of time where you don't have a class. So figure out what you want to do with that time. Do you want to nap? Do you want to go to a coffee shop? Do you want to eat something? Do you want to hang out with friends? Do you want to study? Do you want to join a campus event? Plan ahead of time what you kind of want to do with that time. And take advantage of things like smartphones and your watches and timers, and really try and manage the constant demands that are going to be happening at that time, because there's going to be a lot of things kind of competing for your attention when you're in post-secondary. So figuring out how to manage your unstructured time is going to be probably most advantageous for you. And then finally, front load your week. So what I mean by that is to schedule like your most challenging classes at the beginning of the week or during the time of a day where you have the most energy and you're the most alert. If you schedule your most difficult classes like on a Monday or Tuesday, you're giving yourself that weekend to work on any assignments that you have due. So that really like helps to reinforce that urgency piece, because you have that time there to get yourself ready. And then leave those classes that are a little bit lighter towards the Thursday and Friday. And really pay attention to the part of the day when you feel like you have the most energy, and schedule your most difficult classes if you can within that time. And when you are registering and scheduling your classes, try to be cognizant of the breaks between your courses. So sometimes it might be helpful to have an hour break between each class in case you want to review something last minute, in case you have an assignment you didn't finish, in case you have an exam you need to study for. Having that extra time in between can be really helpful. And now when I get down to the basics. So I had a therapist once that talked to me because I had a tendency to skip my meals because I didn't have time. And the first thing she said to me was, food is mood. And this kind of stuck with me. So right now, everything is mood. Food is mood, sleep is mood, and movement is mood. And the reason why I framed it that way is because regulating emotion is really tricky for individuals with ADHD. And when you're a student, usually eating, sleep, and exercise are the first things that go out the window because you don't have time for it. But the thing is that when your body is tired, when your mind is tired, when you're hungry, you're not going to be operating at your best. So if you're running on a car that's empty on gas, you're not going to get very far. So when it comes to sleep, try and figure out like a nighttime routine that works for you and that's realistic. It could be playing like relaxing music before you go to bed. It could be like brushing your teeth and washing your face and getting to comfy PJs before you go to bed, whatever works for you. And try to sleep at the same time every night. It's going to be hard to do when you're in post-secondary, but if you can, do the best that you can. When it comes to food, I'm not by any means saying you need to have 3 full meals a day, but if you can squeeze in something, then it's something for your body. So something that a friend of mine did for me is that she got me a pack of like granola bars, coconut water, and bottled water to store in my car because I always skip my meals. So at least I have that for me and I can just grab and go on a time when I didn't eat. Same can go for you. Having a snack in your purse, having something in your backpack, anything that's like non-perishable will make it at least available to you in a time when you are feeling hungry and you're really on the go. And then when it comes to movement, like if fitness is not your thing, that's totally okay. But try to find movement in your life in some way. So going on walks, it could be dancing, whatever kind of works for you. It could be like pacing while you're working, standing, doing those kinds of things will help to get that restlessness and that anxiety that you're kind of feeling out of your body. Now, medication is also a really big one. So you want to try and stay on top of your medication as best as you can. If you are going to a school that's out of province, see if you can find a doctor in the area who can help to monitor and manage your medication. And if you're in a different town, maybe someone that's just like a little bit more local, depending on what your commute kind of looks like. And also post-secondary is a really good time to kind of reconsider your dosage and figure out if it's the right fit for you. Also set alarms to remind yourself to take your medication. And if you can, link taking your medication with an activity that you already do on the routine, like brushing your teeth in the morning. So that way it makes it less likely that you're going to forget it. Now, if you can, it would be good to store your medication in a place where it's less likely to get lost. If it does get lost, it'd be good to have a backup plan, just so that way you can still have access to your medication when needed. There is a tendency for misuse of ADHD medication to happen on post-secondary campuses. So depending on where you are, you might want to consider getting a lockbox too. So those are just some kind of things to consider. Now, some extra things to consider is, when is your medication most effective for you? So oftentimes students with ADHD will take their medication at the beginning and very end of their semester. Can you, and would it be possible for you to extend your medication use throughout the semester to make it more likely that you're going to stay kind of on top of things while you're going through your courses? Another thing that often comes up is I'll have parents say, or clients say, like, I can make sure my kids are on top of things. I make sure that they brush their teeth and they get their baths done and they get their homework. Or I can give friends strategies, but why can't I do these things for myself? So if you find that you're more likely to get something done when someone's relying on you, and if that's something that is really like a value to you, your friends, your family, being able to do things for them, then it might be worth it to tag along an activity that you've been really wanting to do with somebody that you care about. So for example, if working out like while you're going to school is really important to you, can you get a friend to go to the gym with you? Because then you're less likely to cancel. You don't want to disappoint this friend. So you're going to be more likely to show up to the gym and you're going to see more benefits. And another thing is to ask for help. So if you have, for example, a friend who's attending lecture with you and who's pretty understanding of you and understanding of your ADHD, can you ask them to tap you on the shoulder anytime they notice you're kind of zoning out? That way they're looking out for you and you're getting that extra assistance. So that way you're not always doing it on your own. Another really important part is looking at your environment. So you want to lean into an environment that really works for you. If that means closing your door, if that means shutting the blinds, turning on music, turning on white noise, working at a coffee shop, working in a library, working at your friend's house, working in a lounge, whatever that means, lean into it and use it. Sometimes you might need an environment that needs natural light, fresh air, kind of experiment with different environments and see what works for you. You also want to bring everything with you. So if you've left something in another room before you start a task, let's say you're writing your paper and then you notice you forgot your phone in the other room or your textbook in the other room. When you get up to go do that, it's more likely that you're going to interrupt your flow or you're going to get distracted by something else. So before you start a task, bring everything that you need with you. So that way you're all set in the environment that you're in. And you're more likely to stick with a group of things. Also give yourself a boost. So when you're starting your day, give yourself something relatively easy for you to kind of check off your list. It's going to mean that you're starting your day kind of feeling more motivated and good about yourself. Also give yourself lots of breaks and some mental rest. So instead of just jumping from one activity to the next, try and take some time for yourself. So take a 10-15-minute break in between tasks to do something that you actually like, to get yourself to reset, and also just to acknowledge what you've been accomplishing so far. And then when you are taking breaks, try and figure out a way to really integrate it into your tasks. So for example, you can say, I'm going to work for 40 minutes and then take a 20-minute break and then work for another 40 minutes. So 40 minutes on, 20 minutes off. That might be a strategy that could work, and try and reinforce breaks in a different kind of way. Also, movement, again, I mentioned is pretty important, but try and find how you can move in your space while you're working. So it might mean sitting on a yoga ball, might mean sitting on like a spinny chair like this. It might mean pacing while you work, standing while you work and study. Try to find ways to kind of get your energy out while you're doing a task. And then also acknowledge and fully accept whether you're an early bird or a night owl. We all work at different times of the day that work for us. So if you can work during a time when you're most alert, this can be tough to do, especially when you have roommates and they work at different hours of the day. But if you're open to communicating with them about it and coming up with a compromise, then it might be more worth it for you in the long run. Okay, a big one is also perfectionism when it comes to ADHD. There's a saying that perfectionism is the enemy of done. And really, that is mostly the case. You really want to let go of perfection and just accept your best work as what it is, and that good is good enough. And this is something that's really challenging to integrate. And to really accept of yourself. So this is not going to be something that's going to be done overnight. But if you can reinforce the idea that progress is more important than perfection, then you're more likely to get things done and you're less likely to freeze up. Something else that can be helpful when you're feeling frozen is to set a timer and try and get anything done. So like set a timer for 10 minutes and do anything. So it could be just like writing one sentence for your paper. That's what you're going to do in that 10 minutes. Let's say you're visiting your parents for the weekend, packing one toiletry item in your bag within that 10 minutes. Now, perfectionism and indecision, it makes us feel really stuck. So what you can also do is really limit your choices. A lot of the time we think that maximizing our choices is better for us because we have a lot of options. But sometimes we end up feeling really paralyzed by having choice. So if you can cut out choice as much as you can in times when you have to make a decision, then you're less likely to feel paralyzed. So for example, even when it comes to like getting ready for class in the morning, can you have certain outfits to pick from? Let's say 3 outfits to pick from when you have morning lecture, because in the mornings you don't have as much energy and you're limiting your choice for what you can wear that day, and it's going to be more likely that you'll get out the door faster. And now we got procrastination. Procrastination and feeling stuck is very, very common. Now, one of the first strategies that you can do is try to figure out how to break it down. Once it's broken down, it's going to make it less overwhelming to do a task. So what you can do is break the task down into smaller tasks, schedule time to do each of those smaller tasks, or set aside a chunk of time to work on it while silencing competing priorities, like putting your phone on do not disturb, clearing your desk of distractions. You can also create a visual timeline. Often for people with ADHD, they tend to be more visual spatial, more motor engaged. So even having pictures or like a whiteboard up next to your desk of the things that you have to do, and just like a brief heading, kind of like I've done on my slides, to make it you interested and to keep that schedule kind of in mind without it feeling really overwhelming. You also want to put your big ideas on paper. So people with ADHD tend to be really big thinkers and have a lot of ideas. But then when the deadline comes, you kind of get flustered because you either have so many ideas or you've forgotten what your ideas were. So as you go through your day and ideas tend to pop up about a project, jot them down somewhere and write them so that you're not going to forget. And so that way, when it actually comes time to work on that assignment, you've got a bunch of bullet points of your ideas. And now you have something to work with rather than starting from nothing. And having structure is really the key to dealing with procrastination. Another key is to tell yourself or ask yourself, why am I doing this? It's challenging when you're working in school on a bunch of things you probably don't like to do, studying for exams, writing papers, doing group assignments. So keeping a note on your desk or on your laptop to remind you of why you're continuing to push through your discomfort can really be helpful in times when you're kind of losing your steam or you're feeling burnt out. So for example, I have actually a sticky note next to my desk that says, "You deserve a life free from guilt and shame." There's like a little heart underneath it. And that's my reminder that, I need to put away the distractions and focus on what's in front of me, because I know that if I don't, I'm going to be filled with feelings of guilt and shame when I walk away from my computer. And all the stuff that I didn't do is going to be the stuff that's really on my mind. And lastly, work on only what is in front of you. So if you begin to worry about and think about other things, which is inevitably going to happen when you're working on a task you don't really like so much, try and write down all the worries that are coming to mind, because then at least it kind of takes it out of your head, and then also reassures you that you're not forgetting about these things and you are going to address them, just at a time that is better for you than right now. And finally, people with ADHD, they're told things like, "You're not living up to your potential, you're lazy, you need to put in more effort, you're unmotivated, what's wrong with you, you're sabotaging yourself, you're stupid, you're sensitive, you're annoying, you're messy, you're flaky, you're always late." Sometimes also you're too enthusiastic is another one. These are things that people will say to you all the time. So why do you say it to yourself? If you find yourself struggling with your self-talk, it may be really helpful to see a coach or to see a therapist to help out with these things. It's not uncommon, if we've heard it so many times, for us to start internalizing these ideas about ourselves. But if you thought about it this way, you wouldn't tell a person who needs glasses that they just need to try harder, see better, squint a little more, and maybe you'll see more. I have a negative 4.75 prescription. Believe me, I've tried to see better. I really don't like wearing glasses or contacts. It just doesn't work that way, okay? And honestly, if you're struggling with ADHD and you're in a classroom, a lot of times you're going to be working 10 times harder than the peer sitting next to you, because you are fighting an internal battle with yourself all the time to get stuff done. So having some more compassion for yourself and recognition for how hard you're working is going to help you more than being another person who's judging you for what they view as not living up to a potential. So my final takeaways from this presentation is, first, just to lean in to what is working for you, regardless of other people's opinions, and reach out to the resources that are available to you. Another is to be patient. Be patient with yourself. There's going to be a lot of times when you're feeling frustrated and you're feeling discouraged and you feel like you've let yourself down. Ultimately, you're doing the best you can with what you have. And this is going to be trial and error, and this is going to be a long process. And it's going to mean revamping things and re-strategizing. But continue to be patient with yourself and have compassion for yourself. And the last is to get creative. Get creative with the items in your inventory. So novelty, reward, interest, and urgency to complete tasks. And also, again, recognize that what works for somebody else may not work for you, and that's okay. But just be open to learning more about yourself and experimenting with different strategies. So that way you can figure out kind of what's blocking you when it comes to your experience of ADHD. And that's everything. So thank you. And if anyone has any questions, it'd be welcome or open. Happy to answer them.
Yes, do folks have any questions for Suweetha? So maybe I'll start with one. For those of us who have family or friends who have ADHD and we see them struggling, what are some of the things that we can do to support them?
Yeah, I think a big thing is to be the one to offer validation and just emotional support, especially in cases where the individual maybe doesn't even know that they have ADHD, but they're coming to you because they have concerns. Um, a lot of times there's a great amount of self-blame and judgment for the fact that they're not able to get things done. So recognizing and seeing how hard somebody's working and that they're really trying and putting effort in can be really helpful and really supportive. Now, in the context of like if you're a parent and you've got a student who's going off to college or university in the fall, and you're wanting something maybe more concrete to support someone, I would suggest like kind of focusing on life skills. So, when and how to use a credit card. Can you create a budget? How do you do laundry? How do you cook for yourself? Because those are in areas where parents would know a lot. And those are areas that students tend to struggle with when they go off and they're living on their own, especially when it comes to managing finances. So if your child is open to it and is coming to you for support in those areas, might be nice to kind of give your nuggets of wisdom. But offering support and not offering or not providing blame and criticism is probably going to be the most beneficial thing.
Awesome, thank you. We have a question in the chat, and for folks who do have questions, please feel free to put them in the chat. There are a lot of apps for ADHD. Which ones would you recommend?
Oh, that's tricky, only because I think it really is dependent on the person. So I think if you like using simple alarm apps, using simple calendar apps can be really helpful. And if you're someone who really struggles with anxiety, using journaling apps can be helpful just to get things down on paper when you need to jot things down. So it is really dependent on the person and kind of what works for you. But I would say to experiment with different apps that are out there and give them your best shot. And if it doesn't work, then you don't have to use it, and that's okay.
I have another question here. Can a person's ADHD ever go away?
So ADHD is a lifelong persistent disorder. So typically when we're looking at diagnosing ADHD, they had to have, like in adults, had to have symptoms present before the age of 12. So we want to look for evidence that had existed. So report cards is something that we often use. And then it's something that tends to maintain throughout their life. So it's not uncommon for someone who are struggling with attention and time management to come in for an assessment, even in their 50s or 60s, and not have had a diagnosis up until then. And the reason why is because they haven't hit that wall, and the coping strategies that they've used so far have been helping them. And now they kind of hit a wall where it's not working anymore. So it's possible to go on for a really long time not knowing you have a diagnosis. It's also possible to get diagnosed really early on, like let's say in grade 3, and then not struggle in the same way anymore. And that's because you've built up coping strategies that are working for you and that are adaptive, and that you figured out yourself well, and you kind of know what works, or maybe you have really good support systems around you too. So having ADHD doesn't have to be the end all be all, but knowing yourself really well and coming up with sort of adaptive coping strategies can get you to a place where it doesn't necessarily feel like ADHD is this big black cloud that's hanging over your head.
Thank you. I'm just going to see if there are any more questions on the chat. Okay, I don't see any more. Oh, I got one. What's your opinion on medication for ADHD?
Okay, medication is always a tricky one. It could be helpful, and I think it's something that might be an avenue worth looking down. If you found yourself coming up with different strategies and something's not working, then it might be worth exploring medication. But it's ultimately up to what makes the most sense for you and what is it that you feel comfortable with. So, sometimes with medications, they do have different side effects that you might want to consider. If you're taking other medications, then you might want to consider how that affects that. And then with something like stimulants, for example, it doesn't stick in your body in the same way as like an antidepressant. So it gives you that flexibility of being able to use it when and how you need. But it's always, my opinion is always like explore the options that are available to you and figure out what works for you. If you find that certain behaviors like impulsivity is a huge issue for you, maybe you're feeling so restless that's hard to even sit down and look at a laptop, then medication might be the first thing to explore, just so that way you can get how you're feeling and that restlessness a little bit more settled. So that way you can actually implement some strategies.
And so is that something that we would talk to our family doctors about or a nurse practitioner about?
Yeah, so talk to your family doctor about it or a psychiatrist if you have a referral, and they can explore different stimulant and non-stimulant options with you. So that way you can figure out what you want to start with and what's best. And they may recommend like changing your dosage, but again, do that at a level that you feel comfortable with.
We have one more question. Are there causes to ADHD?
Yeah, so like right now, we don't have a definitive explanation or cause for ADHD. We do know that it's linked to genetics, is linked to neurological factors like lower levels of serotonin, norepinephrine, and dopamine. We do know that overall, the brain kind of matures at a normal but in a delayed rate. So you could have someone who, for example, is in grade 6, but their brain is sort of at a level that's around grade 3, grade 4 in terms of its development. But in terms of what causes those, I think there's a lot that's still up in the air, and there's a lot of different theories. So, for example, if anyone's interested in Gabor Mate, he has published a book called Scattered Minds, and he has a theory that when it comes to ADHD, it's more trauma-based, and that trauma is linked to some of the neurological changes that you see, and that is related to intergenerational trauma, and that's why you kind of see it popping up in genetics. But there's a lot of different theories out there, and we don't really have anything right now that's definitive.
Suweetha, I have heard people say that young children and older children develop ADHD because their parents didn't kind of put the right structure into place or didn't hold their kids accountable enough. Do you know if that is accurate?
I think research-wise, I can't say that I know, but in terms of my experience working with young kids, I wouldn't necessarily say that it's about structure really early on. I think when you have structure, it can aid a young child who has ADHD and maybe make it so it's less visible to the people around them. So you won't notice that actually happened until that structure is kind of pulled away. So can't necessarily say that it causes ADHD, but what I can say is that if you have a parent who maybe isn't always as present, or if there is trauma within the home, those things may be linked to ADHD just because the child might develop a tendency to kind of disengage from their environment and zone out as a way of coping.
Thank you. I'm just going to check the chat one more time. So folks, if you have any more questions, now is the time. Okay, another question. What do you advise is the best way to help parents understand and accept ADHD and that their kid has?
That's tough. Psychoeducation and trying to inform them about what ADHD really means. I've seen a lot of parents who kind of associate ADHD with laziness and not being motivated enough. And I think as a clinician or just someone who knows a parent and wants to be able to support them, just giving them more information about what ADHD actually is. And recognizing that their child's trying really, really hard. and for whatever reason, they're not able to meet that certain standard or expectation. I think for parents, it can be sometimes having a diagnosis can be like a really big pill to swallow. And so it's hard for parents to kind of recognize and also know how to help their child. This is something that's not really within their control. So how to give them support so they can support their child.
Yeah, thanks for that, Suweetha. I often think about it as like when we are in distress about someone else's situation, that someone else isn't the person we should talk to about it or the person who should help us process it, right? So if a parent is having trouble, they should talk to someone else about their discomfort and the difficulty that they're having so that that burden and that weight doesn't get put on the child and there isn't increased shame or guilt or feeling like a burden. But yeah, it absolutely can be hard. The other thing I think can be helpful sometimes is to remind people in general that ADHD is not a bad thing, right? ADHD is just thinking and perceiving the world differently. And under the right circumstances, a person with ADHD can excel in anything that they want to do. And so it's really about finding what strategies, what conditions, what environments work best for us. And really, that's the case for all of us. When we find what works for us, we are able to thrive. But if we stick with what everyone else does, or we stick with what is generic, we may not necessarily be able to find what works best for us. Yeah. I'm going to check the chat one last time, and then I think. Okay. So thank you so much, Suweetha. Clearly so much knowledge that you have. And so thank you for sharing it with us today. As a reminder, at Silm Center for Mental Health, we also offer ADHD assessments for post-secondary students, for adults. So if that is something that you're interested in learning more about, you're welcome to reach out to the clinic. And thank you all for joining us this evening. We will have this webinar up on our YouTube channel. So if you think that's someone that you know would benefit from learning from this information, you're welcome to share the link. And it'll probably be up in the next couple of days. Suweetha, any last words?
No, just thank you everyone for listening and thank you for all your questions, and I hope you got something out of today.
Awesome. Thank you, everyone. Have a good night.
Good night.